Hi, this is Dr. Lani, and a lot of us have been talking about this study that I posted on in our group regarding Zoledronate, which is really Reclast, and that is given in an intravenous uh, injection, if you will, once a year. It's very strong, and in fact, it has the most of all the bisphosphonates. It's in the bisphosphonate family. It has more impact on the vertebra than any other bisphosphonate out there. So it does have that impact, that's for sure. So in this study, 2,000 women were involved, age 65 and older. And the drug apparently cut the odds of developing a fracture by 1/3 over 6 years. While 190 women getting a saline solution had a non-vertebral fracture believed to be related to brittle bones, only 122 women had such fractures in the zoledronate group. So when we're looking at 1/3, we're certainly not looking at 1/3 of 2,000. We're looking at 1/3 better than the 190. And this is administered every 18 months rather than Reclast, which is every 12 months. So they're looking to see what dose still might be effective. These women had osteopenia. They did not have osteoporosis. And I have a lot of questions about this. Here's one of my big ones right off the top. 2,000 women. Were they all the bone densities done in the same location? So I have a huge problem with that because I know they couldn't be. And the problem with that is I know how many bone densities are read incorrectly, especially women over the age of 65, because a lot of women over the age of 65 have false negative readings because of osteoarthritis or even fractures. So I don't know how well they really looked into all of those factors. And at the very end of this report, it's basically telling you not to completely rely on this report. And I agree with that. It bodes well. I think Reclast in certain situations of extreme cases might be an option. But I'm just saying we need to question these studies. And this is only abstract. I don't have the full study. And there's also evidence that the treatment might reduce the risk of cancer and heart attack. Well, cancer, yes, because we know that bisphosphonates tend to be poisonous to cancer cells, so it's often recommended in different forms of a bisphosphonate, so meta being one of them, because it'll definitely help those people who have either metastatic bone cancer or bone cancer such as melanoma, and those, it really helps them in terms of fighting those bone cancers, there's no question. But then they say here, it provides proper evidence to convince doubters that this is the right thing to do. It suggests a substantial reshaping to our approach. What does that mean? Everyone with osteopenia should be given a very powerful drug. I'm sorry, I don't agree with that. But that's the kind of thing that I worry about when doctors read this. Oh, this is fantastic. I'm just going to start recommending it. Because back in the 90s, Fosamax was given to women, mostly women, of course, as a prevention for osteoporosis. And then the oops factor happened years later when we found that these women who had been on these drugs had bones that were not as strong as people who had not taken the drug. In other words, they were getting the fragility fractures of the hip in places that the strongest bone in the body, simply should not fracture. So again, I have a lot of questions on this. I have to look up the whole study, but I don't think my opinion is going to change on this. Only I'll probably have more opinions about why you shouldn't trust this study. And for those of you who have taken it for good reason, that's good. I'm not. I think it would be on my list in certain situations. But to just suggest that we might be reshaping our approach is a little scary to me. So they found that it lowered the risk of fracture in the spine by 55%. So what does that mean? Remember, there were, low number of fractures to begin with out of 2,000 people. So when we say that lowered the risk of fracture in the spine by 55%, how many fractures were in the spine? Did they do full x-ray analysis beforehand? I'm assuming they did, but I don't know that to be true. And what were the fractures? Were they grade 1, grade 2, grade 3, grade 4? Again, these are, I know how to look at these things in great detail, and I'm not so sure, frankly, even some of these researchers do, because I see studies, well, I won't go into that. But anyway, I'm digressing. So in addition, Zoledronate recipients had a cancer rate that was 33% lower than placebo. Again, how many are we talking about? So it could be 3 people. It could be 10 people. Is it significant? But again, this does make sense because we know that it does impact bone cancer. So that's actually not a surprise. Most notable side effect was flu-like symptoms, okay? But also joint and muscle pain is a significant problem for a lot of people. And here's the thing. This was only a 6-year study. So that's maybe 4 infusions. So what's going to happen to these people 10 years from now if they continue? And a lot of times that's what the recommendations are. Will there be cases of osteonecrosis of the jaw? And I don't think I see here the muscle and joint pain, because I find that absolutely impossible to believe that that wouldn't have been one of the side effects out of 2,000 people. I don't believe that if that's the case. So the last paragraph is what we need to pay attention to. Excuse me. The cautious conclusion is we need to do a much bigger study that looks at heart disease and cancer incidence. It suggests we should test whether this is a chance finding or a genuine benefit as medication. And so we're going to put people on this for heart disease? I don't think so. Again, in terms of osteoporosis, the idea of giving this to people who have osteopenia, who've never had a fracture, because they're not talking about that. Have any of these people had fractures before? That to me is just stunning. Because as many of you know, I was diagnosed in my 40s with borderline osteoporosis. I'm 69 now. Still have not sustained a fracture. So these kinds of studies we want to look at, but also should give you pause. When you're looking at studies and you see that a study is on 20 people, 6 rats, a lot of times supplements are sold based on rats. We really have to be more careful and really look at this stuff a lot more scientifically. Like, what is this really saying to us? And now that I'm looking at this, I have to get the full report. Problem is, a lot of times these studies come out and we only get the abstract and then have to pay for the full study, but I'll see if I can find that. All right, those are my 2 cents, and many of you were writing similar things or questioning it. Good if you question. That's what I want everyone to do.